For her strong commitment to improving care of our most vulnerable and underrepresented populations, I am pleased to recognize Dr. Kimberly Johnson with the inaugural Richard Payne Outstanding Achievement in Diversity, Equity, and Inclusion Award. Dr. Johnson serves as director of the Duke Center for Research to Advance Healthcare Equity and is associate professor of medicine and a senior fellow at the Center for the Study of Aging and Human Development. She's active in the Academy, serving as past co-chair of our Diversity, Equity, and Inclusion Committee, and is a frequent presenter at the annual assembly. This award is a tribute to her inspiring achievements in diversity, equity, and inclusion. Congratulations, Dr. Kimberly Johnson.
Thank you to the Academy. I am beyond honored to have been chosen as the inaugural recipient of this award. Dr. Payne was a wonderful colleague, treasured friend, and exceptional human being. I first met him about a decade and a half ago at a conference. I was just starting my research career and was inspired by his commitment to address inequities in end-of-life care for African Americans through provider education, community outreach, and partnership with faith communities. As a child growing up in a rural segregated town in Mississippi, at a very early age, I witnessed the inequities faced by African Americans across all societal institutions, including healthcare. I also knew that my life's work would include a commitment to social justice and racial equity. Over the last 15 years, I have been honored to do research which elevates the voices of African American patients and calls attention to racial disparities in serious illness care. However, always impatient, I have been most disappointed that at best, the pace of progress to address these disparities has been too slow, and the number of people doing this work has been too few. As I graciously accept this award, I urge fellow members of the Academy, investigators, clinicians, and educators of all disciplines to work to ensure that our growing evidence base and efforts to improve serious illness care include and extend to underserved and vulnerable populations with a long history of inequitable care. This work is the job of all of us, and we must approach it with the conviction that quality and equity are not separate constructs, but that they are inextricably linked. As a field, our progress should not only be measured by how many seriously ill patients we reach, but by the extent to which we reach those who are too frequently excluded. What matters most is not how much we improve what we define as important outcomes for a majority of seriously ill patients, but the extent to which we address the diverse beliefs, values, and needs that improve the lives of all of our patients.